Well, thank you everyone for joining us today. I'm delighted to have been invited to both introduce and moderate the session today, this deLIGHTed talk, which is the 9th edition. And today we focus on good light, creating healthy indoor spaces. And here is our program for today. I will start by giving an introduction talk, highlighting two studies that I have been involved with that highlight the importance of light in human health, particularly in the hospital room. Then I will introduce Kevin Shaw, who will talk about his white paper focusing on lighting design for health, well-being, and quality of light, a holistic approach. Then I will introduce our experts who will be joining us today, Nathan Stodola, Luisa Brotas, and Johannes Zauner, and they will be weighing in with their perspective on the topic. And then we will engage in a panel discussion where the audience will also have the chance to participate through the Q&A tool in the Zoom chat. I'm going to start by introducing myself. My name is Lisa Maria Wu. I'm an associate professor in the Sleep and Circadian Psychology Research Unit at Aarhus University, but I'm primarily based at Reykjavik University in the Department of Psychology. I'm a clinical psychologist by training. I received my PhD at Columbia University in the US many years ago, and it was through my research on the late effects of cancer that I came in touch with light therapy as a potential treatment for ameliorating late effects of cancer, such as fatigue. And it was through that work that my world opened up and I became interested in circadian interventions, circadian health, and light. So I will talk about two studies today with insights from hospital rooms. I want to tell a story, which is that when I was first appointed by Northwestern University as faculty, I was doing research in stem cell transplant patients and looking at light therapy as a potential treatment of fatigue. And when I arrived at Northwestern, one of the transplant oncologists, his name was John Galvin, took me around the stem cell transplant unit, and he highlighted to me that the east-facing rooms were very bright and sunny and facing Lake Michigan, but the west-facing rooms were rather dismal and dark, even though by all intents and purposes they were the same. And even the nurses said to me that the west-facing rooms were miserable. Well, that piqued my interest, and I already knew from my work with colleagues that we see circadian disruption in cancer patients, both due to cancer and its treatment. This is a paper we published in 2022, Ali Amidi and I, where we review this research. So circadian disruption is a factor affecting cancer survivors. We also knew that the strongest entrainer of circadian rhythms is actually light, and that particularly light in the blue wavelength or the blue wavelength range, around 480 nanometers in length. So then I delved into the research examining hospital rooms and patient outcomes. And I found three key papers at that time. One by Beauchemin and Hayes from 1996. They found that mean lengths of stay in a psychiatric inpatient unit for those with severe and refractory depressions was significantly shorter in those in sunny rooms than dull rooms. Then, of course, there was a classic study by Benedetti and colleagues who found that mean lengths of stay were shorter in patients with bipolar disorder who were housed in east rooms versus west rooms. And then even amongst those without mental health focus, spinal surgery patients, I found this study by Walsh and colleagues who found that patients housed on the bright side of the same hospital unit experienced significantly less perceived stress, marginally less pain, and took significantly less analgesic medication than those housed on the dim side of the unit. So these studies gave me some confidence, and I decided to embark on this study with my colleagues called Light's Involvement in the Transplant Experience During Stem Cell Transplant Hospitalization, called Light SCT. We based the study at Northwestern Medicine. And then we have a study here, a very similar population. This is also autologous stem cell transplant patients, but this time at Mount Sinai Hospital in New York. And this time where we programmed environmental illumination rather than just focusing on the hospital environment, the existing hospital environment. The rationale was very similar. We hypothesized that cancer and cancer treatment would lead to disruption of circadian rhythms and would be associated with worse cancer-related symptoms, but that if we introduced environmental illumination and programmed it, that this would lead to circadian resynchronization and prevent cancer-related symptoms. This was also a small-scale study. So this is the light box that we used. We compared bright white light versus dim white light. And the bright white light was around 1300 lux and was considered circadian stimulating, using this particular circadian stimulating outcome variable. And it's similar to melanopic EDI. And then we have the dim white light there, which is non-circadian stimulating. And we programmed the light illumination from 7 to 10 a.m. And we tested a few different symptoms, but it was the depressive symptoms where we found a significant difference between groups. We found a main effect of time, and that in both groups, depression symptoms increased over time, but there was an interaction effect such that depression symptoms increased significantly more in the dim white light group, that's the red line there, than in the bright white light group. And this was a medium effect size. So in short, hospital light environments are not merely passive spaces, but they are active components of patient care. Whether naturally occurring or systematically programmed, light exposure influences circadian rhythmicity, fatigue, and symptom trajectories. So integrating evidence-based lighting into hospital design and clinical routines could represent a simple, non-pharmacological means to promote recovery and well-being. And these are my primary collaborators from Aarhus University, UCSD, University of Miami, Northwestern Medicine, and Mount Sinai, and funding agencies there for these two projects.